Welcome back. A measles outbreak in West Texas continues to spread. The Texas Health Department says it's primarily affecting children and teenagers without measles vaccinations. As numbers grow, doctors warn measles can spread incredibly fast. It's more contagious than the flu, COVID, polio, and most other infectious diseases. CBS News correspondent Omar Villafranca joins us live from the West Texas city of Lubbock. And Omar, where does the measles outbreak stand in Texas right now?
Well, as of right now, the latest numbers that came out, we had around 92 cases in the whole state of Texas. We're expecting those numbers to be updated, hopefully in the next hour or so. And to give a little bit of perspective, this all started in a small Mennonite community about an hour and a half away from us in Gaines County, Texas. And a majority of those cases, almost 70 plus of them, were children who are unvaccinated under the age of 17. Keep in mind here in the state of Texas, to go to school, usually kids have to get their vaccines and have that up to date. But this community, they homeschool, so they're not subject to that part of the rule.
Ah, okay. That makes sense. Doctors are saying that the best defense against measles is obviously vaccination, but we are seeing vaccination rates drop across the United States. What does it mean for the fight against outbreaks like this one?
Well, talking to doctors about this case, they say that the measles vaccine is very, very effective. And let me try to put it into perspective. Everybody has COVID on their mind. Now, if you got the COVID vaccine, you could still get COVID. But when it comes to measles, if you get the measles vaccine, doctors say there's a 97% chance you will not get measles. If you do get measles, it'll be what's called a breakthrough case, but they say that the vaccine is so well that you won't spread measles even if you get it and you're vaccinated. It's so contagious that, let's say I'm positive for measles and there's somebody who is not vaccinated and doesn't have any immunity, there's a 9 out of 10 chance they are going to get measles. It is that contagious. It can linger in the air for hours.
Wow, that is a very important perspective to keep in mind. Omar, there's one case of a person who caught the virus in Gaines County and then left. Can you tell us why that's causing some concern right now?
Yes, and listen, Gaines County is tough to get to. You either got to fly to Midland, Texas, or Lubbock, and then drive an hour and a half or more into that area. But it's easy to get out of. There was a woman from Gaines County who traveled more than 400 miles to San Marcos and San Antonio. She visited Texas State, went to a restaurant. Next day, went to UTSA. Down there in San Antonio, went to the Riverwalk, the famed Riverwalk, visited a Ripley's Believe It or Not down there. Then on the way back up, stopped at a Buc-ee's, which is a southern convenience store that are usually jam-packed if you've ever been to one. So now what they're having to do, the state, is contact trace in those locations, let those restaurants and the universities know, hey, somebody tested positive. They were here within this area. They're talking to that woman. She's obviously cooperating, and they're letting people know, be aware if you're not vaccinated that you may catch it. So if you start getting sick, be mindful. It may be measles if you're unvaccinated.
Wow. Okay. Omar Villafranca, as always, thank you for joining us on the stream today.